Hello, my name is Sarah Hoffman, and in my initial proposition, I proposed that I would like to investigate what it would take for Denver Public School District to become a breastfeeding friendly workplace. After continuous extensive research, I found that there is an alarming lack of support for lactation, both nationwide as well as at Denver Public Schools. Research finds that working directly impacts initiation and duration of nursing. There are multiple confirmed nursing benefits for baby, parent, and the employer. These are the driving factors for what sets the foundation and focus for my ultimate driving question. It is because of these findings that my final proposition for my capstone project is that I make it my goal to help Denver Public Schools become a lactation-friendly workplace. In this presentation, I will go over the history of women in the workforce, history and current lactation laws and policies, research on lactation both nationwide and at DPS, benefits of nursing, my driving question and lessons learned, and program proposal and next steps for Denver Public Schools. Since World War II, women in the workforce has increased from 32% in 1948 to 56.7% in 2016. It is reported that 70% of women working have children under the age of 18, and 75% work full-time. At DPS, there are 15,461 employees, and 11,214 identify as women. 3,090 fall within the age bracket of 21 to 29, and 7,853 fall between the age bracket of 30 to 49, both very common childbearing age brackets. As I have presented before, there were not really any federal laws protecting lactation practices in the workplace. It wasn't until 1964, under Title VII of the Civil Rights Act, that employers were prohibited for any type of discrimination based on race, color, religion, sex, and national origin. And not until 1978 was there an act to amend Title VII that prohibited sex discrimination on the basis of pregnancy. Although both of these laws were beneficial, there were still no laws in place to protect lactation in the workplace. On March 23, 2010, the Patient Protection Action and Affordable Care Act, or PPACA, was enacted. This is a federal law and a provision to the Fair Labor Standards Act. Currently, under the PPACA, employers with 50 or more employees are required to provide breastfeeding-friendly employees a clean and private space to express milk until the baby reaches 1 year of age. Also, under the PPACA, insurance companies are required to provide preventative services such as support, supplies, counseling, and a pump. Currently, the state of Colorado follows the PPACA and also creates a patchwork for the gaps in coverage. In the state of Colorado, under the Workplace Accommodation for Nursing Mothers Act, employers with 1 or more employees are required to provide breastfeeding employees a clean and private space to express milk until the baby reaches 2 years of age. And under the Breastfeeding in Public Act, mothers can breastfeed wherever they have a right to be. Despite these current laws, research finds that employment has a negative effect on the duration and initiation of nursing at work. One study found that working women that plan on returning to work full-time are 1.34 times more likely to terminate breastfeeding than women who decide not to return to work. Important lessons that I have learned is that equity is an important value at DPS and is something that I value as an individual and employee. In order to be more equitable and inclusive, I have switched my language from becoming a breastfeeding-friendly workplace to becoming a lactation-friendly workplace. This is so that the project is inclusive to all employees. Inclusive language and information can be found from the La Leche League and is hyperlinked on my Padlet. Secondly, there are very specific policies on approved furniture that can be purchased, where it can be placed so that it is not a fire hazard, HVAC accessible rooms, human resource support, and specific communication policies. Identifying and including representatives from these departments will help make sure that we are in compliance and that there are no surprises throughout the capstone. Slide, there are 3 different charts. The first chart is data collected from internally and identifies the number of maternity, paternity, and adoption leaves from the past 3 years. This chart is important because it tells us that there's a steady request for leaves that are in support of lactation. The second chart is from an internal employee survey that asked participants if they are aware of designated lactation spaces or mindfulness spaces. 61% said no, and 21% said they did not know. This question will continue to be asked and measured, but for clarity purposes, it will be worded differently so that there are two separate questions. From this question, we can see that not very many employees are aware of any lactation spaces. The third chart shows the results from the HealthLinks assessment, and the lowest score is under the category for health programs and policies, which lactation support falls under. There are multiple benefits from nursing, and the American Academy of Pediatrics recommends breastfeeding 6 months postpartum and continued until the infant reaches 12 months of age. Benefits for the child bearer include decreased breast cancer, ovarian cancer, heart disease, diabetes, rheumatoid arthritis, and weak bones and breaks. Benefits for the baby include decreased chance of SIDS, respiratory and ear infections, diarrhea and other GI issues, childhood obesity, leukemia and childhood cancers, asthma, allergies, and eczema. Employers can also benefit from being a lactation-friendly workplace by seeing an increase in productivity, lower absenteeism, increase in retention, cost savings for families, and decreased healthcare costs. My ultimate driving question was if an organization has built an environment that includes designated lactation rooms, policies that support lactation in the workplace, and supervisor support, then will lactation be more likely to be initiated and continued well into the baby's first year of life? It is because of my extensive research and findings that it is my final proposal to create designated lactation rooms, a district-wide policy that incorporates and enhances state and federal lactation policies that also engage leaders and enhance their support. To put this in perspective, these employees are important organization team members and most likely covered on the district benefits. These babies are our district's future students. Important research articles and best practice materials have been identified and posted on my Briefcase Padlet page. Important materials include pre- and post-program assessments, lactation-friendly policies, funding opportunities, steps to gain leadership support, culture audits, research articles, and other toolkits. I plan to utilize these materials throughout my capstone project. I've started to use some of the materials, such as the Colorado Employer Toolkit, which identifies the first 6 steps for creating a lactation-friendly workplace. In order to complete the capstone project in the few weeks that we have, I've started to assess needs and interests from previous employee surveys and workplace assessments like HealthLinks. The second step is to form a committee, and so far I have myself, the district wellness specialist, and the district manager for ADA and leaves of absence. Together, the committee will look at the materials that I've compiled, and I will facilitate and create timelines and next steps. With these tools, numerous research articles, federal and state laws, and my lactation committee, I believe that I can successfully help DPS to become a lactation-friendly workplace for my final capstone project.